Good afternoon, I'm DL Lee, and I'm here to talk briefly about the effects of coronavirus COVID-19. We're going to talk briefly and swiftly and detailed as possible about the long-term physiological effects of COVID-19, the types of long-term post-COVID conditions, multi-organ effects of COVID-19, the effects of hospitalization in staff, a little bit about the effects of children and adolescents, the impact that it has had on the pharmaceutical industries, the impact that it's had on the environment, the impact that it's had on health communications, dealing with the emotional and sociological aspects, education, and mental health communication. All right, so let's begin. Long haulers are what they call them. They have different types of combinations of health problems dealing with at different lengths of time. According to Pace Hospitals, it is difficult to predict long-term effects of COVID-19. Still, researchers are trying to understand why the symptoms are lasting for long periods of time in patients post-recovery. Some common symptoms, signs and symptoms observed post-recovery that include body pain, joints pain, headache, high blood sugar, fever, feeling of tiredness, lack of energy, coughing, chest pain, inability to focus, and difficulty thinking, lack of mental clarity, or brain fog. There's also rapid heartbeat. There's anxiety and depression disorders, dizziness or lightheadedness, bumps, rashes. Symptoms get worse after mental or physical activity. Now let's look at some of the multi-organal effects of COVID-19. Some people who have had severe illness with COVID-19 experience multi-organ effects or autoimmune conditions over a longer period of time. Symptoms lasting weeks or months after COVID-19 illness. Multi-organ effects can affect many, if not all, body systems, including the heart, lung, kidneys, skin, and brain functions. Autoimmune conditions happen when your immune system attacks healthy cells in your body by mistake, causing inflammation or swelling of tissue or tissue damage in affected areas of the body. COVID-19 coronavirus, called SARS-CoV-2, has already infected 6.3 million people worldwide as of June 2020. And globally, medical emergency healthcare professionals have been struggling to devise appropriate therapeutic strategies and measures against the virus, mainly due to diverse range of reactions and multi-organ failures. Now let's look a bit at the effects on hospitals and staffing. According to TransUnion, strategies to mitigate COVID-19 impacts the healthcare industry. COVID-19 has globally affected industries' employment, economics, and overall livelihood. The health of the society as we know it. The U.S. Healthcare system is no exception. A Standard & Poor's analysis indicated projected costs represent over $90 million in insured medical expenses alone. While still unknown, full financial impacts to providers are certain to be powerful and likely direct and indirect. Providers can expect a flood of unclean claims from their emergency departments, resource constraints, and wavering margins due to elective cases, deferrals, and delayed payments. Although the aftermath of the pandemic is unclear, there is hope, during this era of uncertainty, diligence, tenacity, and best practice revenue cycles processes can help overcome challenges to protect the revenue. This guide details 8 potential scenarios with the tips addressed to each outcome that we may face in the wake of COVID-19. Also, children and adolescents suffer as well. We can look at there's really no difference in the age when it comes to COVID-19. Long-term effects of COVID-19 occur in children and adolescents. Studies have reported long-term symptoms in children with mild to similar symptoms as seen in adults. And most common symptoms reported have been tiredness or fatigue, headache, trouble sleeping, insomnia, trouble concentrating, muscle and joint pain, and cough. Young children may have trouble describing the problems they are experiencing. Information on post-COVID conditions in children and adolescents is limited. It is possible that other symptoms may be likely in these younger age groups. If your child has experienced COVID conditions that impact their ability to attend school, complete schoolwork, or perform usual activities, it may be helpful to discuss with your child's school possibilities of accommodations such as time for tests, extra time and scheduled rest periods throughout the day, modified class schedules, and school administrators and counselors, school nurses are trying to do all that they can to help. Also outdoor sporting events and things like that. You may want to talk to them about providing accommodations for that as well. And just like adults in these young people, although post-COVID-19 conditions appear less common for children and adolescents, they're also appearing, and studies have reported that long-term symptoms as well with mild and severe cases. Multi-system inflammation or inflammatory syndrome in children. Similar symptoms can be seen in adults. Most common symptoms are reported, again, as tiredness, fatigue, etc. Now let's talk a little bit about the impact on the pharmaceutical industry. One of the top Bayer field staffers include sales, marketing, access, and medical teams have all been asked to work from home. Pfizer has been asked to work from home. GlaxoSmithKline, all employees in the US are working remotely. So a lot of these top providers are working from home since 2020. Also Johnson & Johnson, Biogen, even if underway before the COVID pandemic, or before the pandemic, COVID-19 has given businesses an unprecedented opportunity to accelerate and implement technological fueled changes to the way that they operate and engage. For pharmaceutical companies, the pandemic has forced many to rethink and readjust supply chains, clinical trials, manufacturing processes, and in the end, customers reach. If pharmaceutical companies have relied on traditional face-to-face sales force and physicians interactions before the pandemic, then COVID-19 has made a 180-degree change in reinforcing the communication approaches. Now let's take a look at some of the environmental impact in response of COVID-19. Some positive effects, of course, by lockdown. When we were under lockdown, there were less fuel emissions going, with no planes, no flights, less cars on the streets. And so this made our air cleaner for a moment. This gave us quality breathing in the air. However, there were much more negative adverse effects as it pertains to COVID-19, such as medical waste and waste management. A big concern over medical waste was resulting from COVID-19 crisis, including waste generated by hospitals, especially patients being treated, waste from quarantine areas, and disposable personal protective equipment as well. Then there were effects on the chemicals in the environment, biodiversity, and pollution. Now let's look at the impact of health communications due to COVID-19, starting with the emotional aspect, emotional and psychosocial aspects. Mass media plays an imperative role and can provide a unified platform of public health communications, comprehensive healthcare education guidelines, and robust social distancing strategies. And mass media, social media did a great job at that. Social media, however, engaged in increased manifold and implausible claims of the virus affecting the geriatric population, which made the young population vulnerable. Many things were being said that was not necessarily scientifically proven at the time, that elderly people were contacted with COVID-19 virus quicker, and that young adults, young people had less of a chance because of their youth. Well, this was causing younger people, millennials, high schoolers, and college people go out and go on spring break and gather in parks and in the beaches and have parties. And this was causing adverse effects. This was causing the spread of COVID-19 even more among millennials. Let's talk about health education and communication. Dealing with health communication, social media groups realizing that the utilization or the need for third-party fact checkers, because there was just a lot of information going out all over Facebook, all over Twitter, because of the panic. And so because information was not yet known and people were pushing unscientific information and untrue information, fact checkers were given to us. And now let's talk about the mental health communication. Stress is a normal physiological response of human beings being vulnerable to unfavorable conditions. Physicians caring for patients with COVID-19 has seen positive and negative effects due to the pandemic, physically and mentally. Mental health organizations and religious organizations have been doing great jobs with dealing with the utilization of social distancing and social media when it comes down to practicing social distance and still being able to deal with the healthcare needs via social media or telephone or these type of things help people out a lot when it came to mental health. We know that when it comes to mental health, behavioral therapy, physiological as well as the mental are combined, and sometimes adverse effects to our physical bodies can happen when we are overly endowed by depression and anxiety. Tanya Lerman, who is an American psychological anthropologist, notes that mental health and religious practices and rituals create deep positive changes. When it comes to religious organizations or religion, this helps change the health overall for the believers and the followers of these religions and organizations. She said that prayer is a lot like a cognitive behavioral therapy. So we must remember that this COVID-19 has had a positive and negative effect, more so negative effects on our environment, on our physical and mental health. So let's just push through for a better tomorrow. Until next time,